My name is Nathan Wallace, and this is my presentation on patient-generated health data. We're going to look at potential uses for some oncology patients, limitations, and talk briefly about big data. So patient-generated health data, this is any data that's patient-recorded and reported. It places a lot of power in the hands of the patient to track their own health and track how different therapies are affecting them pretty much. It can include a wide range of data, anything from if they take their vital signs every single day, blood glucose monitoring, activity levels, steps, weight, the food that they take, if they're tracking calories or macronutrients, stress levels. They can do a mood journal. All of that is considered patient-generated health data. Within the realm of patient-generated health data, you have PROs and ODLs, patient-reported outcomes. Those are primarily used in clinical trials, what the patient reports is feeling or noticing during the use of this new medication. Observations of daily livings, these are things more like a mood journal, a stress journal, if they do a daily write-up of their health, explaining how they felt that day. And then the electronic health record, one of the difficulties with the electronic health record is just the fact that we are only seeing a small percent of the patient's life, the data that we have from when they're in the hospital or from their visit to their primary care doctor. It's 1%, 2% of their life. So the potential for patient-generated health data is to take data from every single day of their life and have it integrated into what we see in the electronic health record. So for chemotherapy patients, symptom management is one of the more difficult aspects of treatment. Nausea and vomiting and diarrhea can be really bad. Neutropenia is a big one for our leukemia patients just because it puts them at such a high risk. Neuropathy, dry and cracking skin, hormone disruption, cold intolerance. Hormone disruption can also affect sexual function. It can affect their appetite. And mouth sores can also affect appetite. So their nutritional status will decrease, and so their health generally is not going to be as well simply from that fact. So if you have a patient who is daily tracking when they feel nauseous or tracking the onset of potential fever, or how the treatment is affecting them on a daily basis, and then that data is reported to the physician, they get a much better picture of how this treatment is actually affecting them. So for our palliative chemotherapy patients, it'll be huge because they can see, okay, this is really negatively affecting your quality of life. How can we adjust this treatment so that your quality of life improves? And also we can see it'll be easier for clinicians to notice toxicities in patients when they have data from every single day. Clinical trials for cancer treatments with patient-generated health data, there are researchers who are saying that we'll be able to do shorter clinical trials with less participants, and they're going to cost less money because we have this increased amount of data. So that will take chemotherapy drugs and get them to the market faster, other potential treatments to the market faster for these patients, where our understanding of the disease is increasing at a rate that the drugs aren't able to keep up. So with patient-generated health data, there's a potential for bringing newer treatments that are more effective to the market faster and sooner. So that would be huge for some of our cancer patients. There are, of course, several limitations with this. The volume of data. If a patient is every single day tracking their activity and their food, or they have a mood journal, unless there's a way to compute that and trend it and make it easier for physicians to use, the sheer volume of data is going to make it unusable. Privacy, making sure that anything sent from the patient to the physician automatically is encrypted and safe, so that way we don't have any HIPAA violations and privacy issues for our patients. Integration, if we can find a way to maybe integrate Apple or Fitbit, Garmin, MyFitnessPal, the info that these are apps that people are already using, and they have large followings and they're pretty user friendly. So is there a way that we can integrate what's already there into the electronic health record that we use at work? And then ease of use for patients. Can we automate this? If they're checking their vitals every single day, can we have a way that that information is automatically uploaded and sent so they're not manually having to every single day put in this information? If you ever recorded your weight or your food or your calories or your steps, if you're trying to manually record that information, it is absolutely exhausting. So if we can automate that process, make it easier for the patients, we're going to have they're going to record more data, so we're going to see better outcomes because of that. On the left, we see Apple's health dashboard. On the right is an example of a Fitbit health dashboard. So if we can imagine something like this integrated into the EHR, where a clinician has a tab they click on, and then this information pops up where they can trend how well they're sleeping every single day, how many calories they're taking in every single day, their weight. It would make it this is how it could be integrated in to make it easier for the physicians to see, oh, okay, on a daily basis, since we've started this medication, or since we've tried to change your life in this way, look at how your weight has trended, or look at your blood pressure, how it's actually changed. So it gives a much clearer picture of what's actually going on within the patient's life. Some extras. On the left is a talk by Talithia Williams, Own Your Body's Data. Really good on the importance for individuals to take their health data and then go and talk to their clinician about it. Even if it's not something that's automatically synced, she has some really good uses of recording data on a daily basis on your body. And then Apple on the right is working with researchers. They've developed apps, dozens of apps for different research projects that anybody who it affects can participate in. So some of the apps that they're working on, they have one for Parkinson's disease to try to find the best treatment for Parkinson's. They have a seizure predictor app integrated into the Apple Watch. It's for patients to use. They're collecting data before, during, and after seizures to try to predict them. And then with autism, they have an app that uses facial recognition with children to try to diagnose autism at a younger age. So amazing uses of patient-generated data, both on the individual side with a TED Talk, and then also big data with Apple. So some references. I hope that you found this informative and useful, and going forward, ideally, we'll be able to encourage our patients to record data on a daily basis, and that we can also do the same for ourselves, and that is going to help push the integration and the use of patient-generated health data for the more people that we can get using it and trying to talk to their physicians about it. So thank you for your time, and I hope that you enjoyed this presentation.